So, are there recovery differences between a Preservé augmentation and a traditional augmentation? So, let's start the day of surgery. So, the procedure itself in the operating room is a bit faster with Preservé versus a traditional augmentation. But in truth, both of these surgeries are very quick. Now, I'm going to disagree with some of my colleagues a little bit on this, but I do find that the patients that have local anesthesia and sedation versus general anesthesia, there's like no difference between them. They wake up with the same speed, they're home in 20 minutes. I don't find any difference between the type of anesthesia that's chosen, as long as you have a skilled anesthesiologist that knows what they're doing. So, for both of the options, the day of surgery is pretty similar. Now, from a pain standpoint, I also find that the recovery is essentially identical between these two groups. Both of these groups in my practice rarely use their opioid medicines, and they're very comfortable on Journavx and Motrin and long-acting numbing agents. Now, the real difference is with activity and the things we allow patients to do. And you're going to find different surgeons with different activity restrictions. But in my practice, I allow the Preservé patients to exercise immediately, lay on their side immediately, and really return to normal life right away. Whereas my traditional augmentation patients, I do like them to be a little slower with return to activity. So I don't really want them exercising until 2 weeks after surgery and then full exercise at 1 month. And I typically don't allow my patients to sleep on their side until 1 month with a traditional augmentation. So from a recovery standpoint, there's not a big difference. It's mainly just return to activity that I find difference. The main difference with Preservé versus traditional is just with Preservé, of course, it's tissue preserving. So you are maintaining the ligament structure around the breast a little bit better. And we do think this allows implants to be placed more precisely, the more precision where the implants actually place, and it's more likely to stay there. So those are the main difference between the two. Both awesome options. I do both in my practice all the time.